We start this section by looking at two very important drugs, cyclosporin and tacrolimus. These drugs have a common mechanism, but they actually start by binding to different molecules. Cyclosporin binds to cyclophilin, whereas tacrolimus binds to FK binding protein. But in either situation, it results in decreased calcineurin and decreased activation of T-cell transcription factors. This causes a reduction in interleukin-2, 3, and interferon gamma. This is the reason why these drugs have a very important immunosuppressant effect. When you think about the uses for these two drugs, cyclosporin is very, very popular. In fact, it's the drug of choice for organ and tissue transplants, but it's always used together with other immunosuppressants like mycophenolate, steroids, and various other drugs that sometimes we would call anti-cancer drugs like cyclophosphamide. Tacrolimus is used alternatively to cyclosporin in renal and liver transplants. Mycophenolate is another immunosuppressant. It's an inhibitor of de novo synthesis of purines, and it has certainly adjunctive immunosuppressant effects, allowing us to reduce the dose of other immunosuppressants like cyclosporin. Both cyclosporin and tacrolimus have some nephrotoxic effects, and cyclosporin is the one that can cause gingival hyperplasia. So once again, that list of gingival hyperplasia drugs would include cyclosporin, phenytoin, and dapine calcium channel blockers. Azathioprine is another immunosuppressant. This drug is converted to 6-mercaptopurine. Remember, 6-mercaptopurine has to be activated by HGPRT, but it also has to be inactivated by xanthine oxidase. And that's why, if you're on allopurinol, not only will you interact with 6-mercaptopurine, but also with azathioprine. The dose of each of those drugs would have to be reduced if you're taking them concurrently with allopurinol. This slide looks at anti-D immunoglobulins. In fact, if you're dealing with an Rh-negative mother, you want to give her the RhoGAM shot within 72 hours of an Rh-positive delivery to prevent hemolytic disease of the newborn in subsequent pregnancy. Basically, this is a human IgG antibody to red cell D antigens, and it can take out any fetal Rhd-positive erythrocytes. This table looks at several of our very important monoclonal antibody drugs. Of course, these drugs are so numerous today, we're just going to list several of them in this table here, many of which we've already covered in previous chapters, like abciximab, the antibody drug that targets glycoprotein 2B3A receptors and used in angioplasty procedures. Infliximab and adalimumab. Both of these are anti-TNF drugs. They can both be used in rheumatoid arthritis, and we commonly see infliximab used in Crohn's disease. Trastuzumab we covered in a previous section. It's a drug used for breast cancer that's an antagonist to the ERB2 receptor, also known as the HER2/neu oncogene. Certainly those are 4 drugs that you should be familiar with. If you have an opportunity to review these other drugs in the table, you will also be prepared for these types of questions dealing with drugs like daclizumab, a drug which blocks interleukin-2 receptors and is useful in kidney transplants. Nirumonab is a drug that blocks allograft rejection, also used in kidney transplant. Palivizumab, it's a drug that we covered in an earlier section that can be used to prevent respiratory syncytial virus. It blocks the RSV protein. And finally, rituximab, a drug used in non-Hodgkin lymphoma, which binds to surface proteins. When we think about clinical uses of cytokines, certainly let's focus specifically on interferons. Interferon alpha can be combined with ribavirin. In particular, we can use this combination for hepatitis C infections. But interferon alpha is also useful in hepatitis B, leukemias, and melanoma. Interferon beta can be used in multiple sclerosis, whereas interferon gamma in chronic granulomatous disease. Now that we've finished this section, let's do one practice question together. Pause the video, review on your own, and let's discuss. A 57-year-old woman comes to the physician for a follow-up examination after receiving a liver transplant. As part of her treatment regimen, she receives a drug that binds to FK binding protein and inhibits calcineurin activation of T cell transcription factors. The drug is most likely choice E, tacrolimus. Remember that both tacrolimus and cyclosporin have a common mechanism of inhibiting calcineurin, but they bind to different factors. Tacrolimus to FK binding protein, cyclosporin binds to cyclophilin.